আসসালামু আলাইকুম। আমি ডক্টর জোহরা মুন মুন। আমি অ্যাসিস্ট্যান্ট প্রফেসর গাইনি, কর্নেল মালিক মেডিকেল কলেজ, মানিকগঞ্জ। আজকের টপিক হচ্ছে ইউটিআই। আমি ইউটিআই এর উপরে কিছু ইম্পর্টেন্ট কথা বলবো, যেটা সাধারণ মানুষের শুনলে তাদের হয়তো কিছুটা হলেও কাজে লাগবে। ইউটিআই হচ্ছে একটা ব্যাকটেরিয়াল ইনফেকশন যেটা ইউরিনারি ট্র্যাক্টে হয়। সো the bacteria enters into the urinary system, kidney, ureter, bladder and urethra, and women are more risk, 50% more risk than men because of their shorter urethra. ফিমেলদের ইউরেথ্রা ছোট থাকে। ফর দিস রিজন তাদের চান্স অফ ইনফেকশন অনেক বেশি থাকে। অর্গানিজম কিছু আছে যেটা এটার সাথে রিলেটেড, সেগুলোর মধ্যে মোস্টলি হচ্ছে ইকোলাই হচ্ছে 75 to 95% কজ, এবং এটা আসে জিআই ট্র্যাক্ট আর গ্যাস্ট্রোইন্টেস্টাইনাল ট্র্যাক্ট থেকে আসে। তো আদার অর্গানিজম যদি আমরা বলতে চাই, তাহলে রিস্ক ফ্যাক্টরের মধ্যে বাকি অর্গানিজমগুলো হচ্ছে ক্লেবশিয়েলা নিউমোনি, প্রোটিয়াস মিরাবিলিস, সিউডোমোনাস অরিজিনোসা, and some are gram positive. They are Staphylococcus aureus and Enterococcus faecalis, and group B streptococci are mainly. So যখন ইউটিআই আসবে তখন আমাদের প্রেজেন্টেশনের মধ্যে মূল বিষয়টা হবে রিস্ক ফ্যাক্টর, who are more important, who are mostly involved. The risk factor are iatrogenic, some are iatrogenic, some are indwelling catheter, some are antibiotic use, and some are spermicide. So iatrogenic means long-term antibiotic use. Sometimes antibiotics subside the normal microbial flora, ultimately overhang the pathogen. And the indwelling catheter, long-term catheter use and insertion of the catheter are either aseptic precaution not maintained, and spermicide, which also destroy the normal vaginal flora. And behavioral change, voiding dysfunction, frequent or recent sexual intercourse and voiding dysfunction are very important. Others are vesicourethral reflex, female sex, pregnancy, and others are familial tendency, susceptible to uroepithelial cell, that is decrease immune deficiency, decrease immunity, any drug or any disease which cause depression, decrease the immunity level, and immunity level when normal distorted or disturbed from normal, then chance of infection is much more. So UTI tends to cluster at families, and susceptible uroepithelial cell where the immunoglobulin A, IgA, who is the main protector, with the immunoglobulin A is disturbed, ultimately disturb the uroepithelial mechanism and leads to organism multiply. So how pathogenesis, how it occurs? When bacteria from GI tract enter the urinary tract through urethra, begin to multiply, where it adhere to the lining of the epithelium and ultimately cause inflammation and tissue damage. So symptom of UTI. UTI two types: upper urinary tract infection and lower urinary tract infection. Upper urinary tract infection, acute pyelonephritis, and lower is urethritis and cystitis. So in case of upper urinary tract infection, the patient is suffering from pain in back, flank, high fever, hematuria, chill, nausea and vomiting. And when the cystitis and urethritis, the pelvic pressure, lower abdominal pain and discomfort, frequency, painful micturition and burning micturition. So the types of UTI is divided into complicated and uncomplicated UTI. In case of uncomplicated UTI, when cystitis and pyelonephritis occur in the premenopausal woman, there is no functional abnormality in the urinary tract and there is no comorbidity, then this is uncomplicated UTI. But in case of complicated UTI, if the risk per patient are when patient is child, when patient is pregnant, when patient have structural or functional urinary tract abnormality or any obstruction of the urinary flow, or patient with diabetes, hypertension, chronic kidney disease, or immunocompromised patient with disease which have immunocompromised. And in case of other feature is recent surgery in the urinary tract. So in case of diagnosis we collect urine, clean catch mid-stream urine. Sometimes urethral swab if suspect STD. So urethral swab should be collected before urine collection. And urine culture, of course, for complicated UTI, urine culture is mandatory. Sometimes, if needed, ultrasonography of KUB, kidney, ureter and bladder. So management in case of UTI, antibiotic is very important, play major important role, and plenty fluid intake, urinary analgesic, cranberry juice, urine alkalinizer, avoidance of irritant like caffeine, alcohol and acidic food. So proper hygiene, keeping from patient to good habit, and whipping patient from back to front to back during defecation and micturition, and urination before and after sexual activity, which is very important. So in case of pregnant woman, the treatment protocol slightly different. In asymptomatic bacteria, in uncomplicated woman, the patient who are not pregnant, antibiotic not used, not indicated. But in case of woman when bacteria without symptom, antibiotic mandatory, and others are symptomatic patient must need antibiotic, urine culture before starting antibiotic, and antibiotic dose should be judicial dose and time, duration. So we come to complication of urinary tract infection. Now complication for recurrent infection. What is recurrent infection? Recurrent infection means 2 or more episodes of infection within 6 months and 4 or more infection within 1 year, which is recurrent infection, which cause permanent kidney damage from acute to chronic kidney infection due to untreated UTI. So in pregnant women, the risk of low birth weight babies and premature delivery and urethral narrowing due to stricture if it is associated with recurrent urethritis or gonococcal urethritis, and sepsis is life-threatening. So prevention of urinary tract infection is very important for our discussion. How to prevent? So stay hydrated. Always stay hydrated, drinking adequate fluid, that is water, help to flush bacteria out of urinary tract, ultimately reducing the risk of infection. And practice good hygiene. Always wipe from front to back after using bathroom to prevent the spread of bacteria from anus to urethra. So urinate regularly, urinate frequently and completely to help and prevent bacteria from accumulating in the bladder. Avoid irritant, that is caffeine, alcohol, acidic food, as they can irritate the bladder and worsen UTI symptoms. Practice safe sex, use condom and urinate before and after the sexual activity, which reduce the risk of UTI. Wear breathable clothing. Avoid tight-fitting clothing, and option for breathable fabric to prevent moisture and build up the genitalia, which can promote the bacterial growth. Take probiotic, which is very important. Probiotic rich food or supplement in diet can promote the healthy bacteria in gut and urinary tract, ultimately reducing the risk of infection. And seek prompt treatment. If any symptom, frequent micturition, burning sensation, and cloudy or foul smelling urine, pelvic pain, seek medical attention promptly as early as possible to prevent complication. Avoid holding urine. Holding urine for extended period can increase the risk of UTI by allowing the bacteria multiply within the bladder. So know your risk factor. Be aware of these factors about gender, sex, sexual activity, urinary tract abnormality, and underlying health condition that may increase your risk of developing UTI. About drug, the new generation antibiotic for UTI now in market, fosfomycin, which is Utifos, is a very good drug. Fosfomycin inhibits the first step of peptidoglycan synthesis an unique mechanism unlike any other cell wall synthesis inhibitor. So extremely low chances of cross resistance, and which is very good drug for new emergence in UTI.